Hey everybody, how you doing today? Boy, we got a heat wave going here today in New Jersey. It is hot, and I'd like to talk to you about a hot topic. How, as an orthopedic surgery resident, you can be a great assistant in the OR. So number one, you have to remember there are no innocent bystanders in the OR. You are always doing something from the moment you enter that OR until the moment you leave with that patient. You are always doing something. When you enter the OR, you're going to help the nurse and help the tech open the trays, see whatever you can do for them, get bandages prepared for the end of the case. You're going to get the positioning equipment ready for the patient, make an axillary roll, get all the foam padding for the patient so that patient is positioned comfortably. You're going to make sure that you have all the supplies that you need for the end of the case. You're going to be actively paying attention during the case. So that's number two, actively pay attention. You want to be adjusting the lights. Look at the field. If you can't see what's going on in the field, neither can the surgeon. Always anticipate, adjust those lights. Grab retractors, retract tissues out of the way. Change the position when necessary of the limb or the patient, whenever it's necessary. Ask for the table to be lifted or lowered, but actively pay attention. And number three is be prepared and anticipate ahead of time. So during the closure process, you're going to be following the surgeon with the suture. You're going to be holding the excess suture. Follow him along, pay attention. Anticipate when you're going to need to cut the sutures. Get those scissors in your hand before he even asks you to cut it. You're going to prepare for the end of the case. Think ahead of time. Ask the nurse and ask the scrub tech for the appropriate bandages, the drains, whatever is necessary. And if the surgeon is going to allow you to close the wound, you're going to close that expeditiously. So remember, number one, don't be an innocent bystander. Always be doing something. Number two, actively pay attention to what's going on in the case and be an active participant. And number three, be prepared and anticipate things ahead of time, and you'll be a great assistant in the OR. Best wishes.